زما نوم عایشه دی، زه د افغانستان یم.
My name is Lieutenant Colonel Carrie Latham. I'm an Air Force craniofacial plastic surgeon stationed at Walter Reed. Aesha is bravery and resiliency. She has overcome so much.
بیازدی alta Amerika دقیقا ترقلما روزگان ترقلما بیامه دقیقا کلم فلای می بودم آمریکایی شفاخانه دقیقا هسپتال تا آقا به مسیر کمکی دست کرد.
I got an email tasking that we would have a patient to treat that had approval for us to take care of her for the purpose of nose and ear reconstruction. I wanted to ensure that we moved forward seamlessly, so we built a team.
Well, I'm Gary Brigette. I'm a plastic surgeon.
He has dedicated his entire professional life to rebuilding noses. And I remember as a resident reading articles that he wrote and books that he wrote, and I've seen him speak at meetings. I just knew who he was and Googled his name and phone number and cold called him.
She said, we have a patient we'd like you to take care of. And she began to describe the patient. I said, oh, I think I know about this patient. I've seen her picture.
And he was excited to be on the team, and we loved having him.
The thing about the plastic surgery is, you know, it can be a little exciting and a little bit scary, and I think we thrive on that. So here was a new adventure.
The main objectives of the surgery were to try and restore as normal of appearing nose and as normal of a functioning nose as possible.
The first stage would be to do what we've done since was described by Sir Harold Gillies, a surgeon in World War I, who said, put the normal parts in their normal positions. You look at the face, and if things are scattered around, part of the nose over here, eyelid here, put everything back where it belongs first, and then assess the deformity.
There are no parts on the body that look like a nose, but we knew we needed to create the lining, the skin, the undersurface of the nose.
We decided we'd use a free microvascular flap, that is skin from somewhere else. And the usual choice would be the forearm because it's easy to do.
The framework, the structure and support system of the nose.
We decided we'd use a piece of rib cartilage to support this part of the nose and give it projection. It's a strong piece of cartilage. It stays for a long time.
And then the cover, a skin match that looks as similar to the other skin on the face as possible.
And then the only material that really works for covering all this and making it look like nose is forehead skin.
We presented to her from the beginning that we expected there to be between 8 and 12 surgeries for the nose, and then additional surgeries for the ears, and that the timeline would probably be between 2 and 3 years. I think that Walter Reed is the best place for her to be cared for because there's other patients going through complex reconstructive journeys as well. So when you walk around these hallways, you see other patients that have similar journeys and you don't feel alone. I already knew that plastic surgery and reconstructive surgery can change so much, and that's why I wanted to go into it.
زیاده حقیقت داشتم زیاد وقت نه چه وقت نداشتم حقیقت داشتم همیشه دکتر لیتر نست دقیق مخنوان چه خدا.
I'm extremely grateful, you know, for what has been done for Aesha. You know, yes, we're doing a lot of things around the world, but to me, that was the noble things to do for any human being, which has been done in here.
She's a very well-motivated and kindly doctor who wants to do the right thing, and I got that feeling, and that helped a lot.
She wanted freedom and she wanted to be whole again, and I think we've helped her accomplish part of her goals and helped her restore her nose and ears, and she's looking forward to moving on in the world, and I'm excited to see what she does.
I mean, everyone gave 100% towards her recovery, toward her surgery, you know.
Depois de que dia fechada para hoje uma fase قربون جورسی همیشه دکتر طول دکترانه به شکل که آمد دیدم من از این که آمد همیشه من طول سرجری خلاصی که را زیر جوره کردم.
To me, knowing that she's happy and that I might have helped her go even further is really the honor.